Yeah. Okay, I think it's time to start. Welcome all. What we will want to do is we discuss what we learned yesterday in the classification with the athletes. And so I asked you, perhaps you already have questions or something special you noticed. Like I know from some people that they noticed that it's very good to know in advance what you have to do. So you have a more systematical way of testing. So that's one of the things we were discussing. So I would like to know, how was it for you? Was it bringing more understanding of what classification is, how to do? I would like to hear something from someone. Someone has... Oh, you're thinking. I have the microphone. You want to say something?
Hello. Well, first of all, it was kind of difficult for us to do the testing in order for the athletes to be comfortable.
Yes.
You know, because we didn't have any experience in testing.
Yeah.
So
Yeah.
we needed some experience to make the athletes comfortable, and communication with the athletes, it was kind of difficult because we had to think what to do, so
Yeah.
no time for us to talk with the athletes.
Yeah, that's exactly what happened. And it was good, very good to see. It was a difficult assessment, and they were focusing very well on doing the assessment, but they forgot there was an athlete as well. And it's when you're a professional, you're working as a doctor or physiotherapist, you know what to do, and you're easy. You know exactly how you do your exams and what you write down and everything. And now it's new, and you have to be a student again, and that's sometimes difficult to make this step. But it's good to understand. Oh yes, the athlete knows more communication, knows more assurance, and you can only get experience by doing. So that will be always. So we're very happy that the athletes were here to help us. That you can. Study and you can learn and make mistakes. With making mistakes, you learn the most. So it's very good there. Other things. Were there questions in the groups that coming up? Perhaps we can start a little bit with the beginning. So when we do the classification, everyone started in the beginning, oh, I have to ask all those questions. And I noticed doing with the fourth or the fifth classification, everyone was already doing it more easy. And do you know why we ask all those questions about how long they ski and how long they train? And do you know why we do it? Why we ask how long they ski and how they train? Might it affect your classification? For safety? Yeah, safety of athletes is also very important. Certainly when you do something too difficult and they might fall, I don't want to break them something when I classify them. Yes, that's important. But it's also... Yeah, if it's stable or progressive. Yeah. That's also one of the things you want to know, if the impairment is stable or progressive. But one thing is also very important when, you can keep it, Mayo. It's also one thing important, we want to know if we have to meet athletes who we can ask really good training things, or someone just starting with the sport. And when we do the observations, what we'll do after this, we do observations. When someone has just been skiing 1 year and he is skiing down with, say, making a snowplow, is that because of his impairment, Or is that because of he is just not a good skier? So that's also important when you see someone coming down and not able to carve, to edge. But yeah, he did just learn it. But when he is already skiing for 25 years and it's the side where he is impaired and is not able to edge, then it's due to the impairment. So that's very important to know. Is he new in the sport? Did he train? So and we did research with World Cup athletes, and it was very good to see how well they are doing also all the tests inside. But you still see when the impairments affect our tests. So that's in the interview part. And sometimes it's a bit strange that we first ask about how you ski, and then we ask about the diagnosis. But it's normally we look up already in the paperwork before when they enter that they have a spinal cord injury or amputation. So that's more logical to do. And it's also very important to ask how they ski. But it's not, yesterday it was important to ask if they were going to ski or to do a snowboard. But normally you know he's coming for the skiing or he's coming for snowboarding. But in skiing it's important to know, are you going to sit or stand? Yesterday in our simulated classification, Rangveld asked me, are you standing or sitting? So I told him I'm sitting. But it was easily mistaken. When someone walks into the room, you think he will be a standing skier. So that you must know. So I think in the first part of the interviewing, you have more?
I think for our group, we discussed how difficult the testing of the neurological presentation, so cerebral palsy, compared to an athlete with amputation. There's a big difference. And assessing an athlete with amputation can be very quick and simple, but assessing an athlete with a neurological condition can take much longer. But I think what is important is that when you go through the assessment, that you take the time, and this is what we discussed yesterday, you take the time and do all the steps to make sure that you come up with the right answer in the end. And it's okay that an assessment might take 1 hour because you want to make sure that you're doing the best thing for the athlete. So I think it's when you do classification, we have a schedule. Sometimes we only have 15 minutes allocated for an athlete, but if we know that it's going to take a bit longer, that's okay, because it's the best thing for the athlete. So we spoke about that. Yeah.
And certainly in the neuro testing, someone asked me, is it okay when the other panel, the other classifier tests as well? And we, certainly when it's an important measurement, you want to know, is it Ashworth 2, Ashworth 3? And it's the important measurement, we always check both. And when we're working together, we only look, and then the other one comes and does a part of the testing. The same in the reflexes, when you cannot really find them very well, you don't have to say a word, you just give the hammer, and the other one does the test. So we both must be sure if what we are looking for is there or not. A good example is also when you are assessing a spinal cord injury and we want to know if he has some muscle power or some muscle fibers in his abdominals, because that's the difference between a 10-1 and a 10-2. And it's very difficult to palpate. So you try and you try and you try and the other one tries, and then we look at each other and somewhere we look, okay, I agree, I cannot feel anything. So yeah, it's always good to do it together. It's not that someone is making just the notes, the other one is just doing the assessment.
Does anyone have any questions about the neurological assessments from yesterday? Yeah?
The most part of cerebral palsy is very nice, but they have ataxia or yesterday he and she have no spasticity, but a little bit, pathology reflex like Babinski
Yeah,
and a little ataxia.
yeah.
Do you have any record that cerebral palsy patient athletes won the game? Do you have any record? Win the game?
Yeah.
Because I think at that time we couldn't give him any lower extremity weakness, so we couldn't give him LW3, but some other group gave him LW3.
Yeah.
Do you have any record that the athlete with cerebral palsy win the game?
Yeah,
medal?
we have. In the video we will have, you see some athletes at a higher level with CP, but I must say that the one with atetosis and certainly the one who has it most in his upper body and not so much in his lower body, we don't have very much that come very high. They start the skiing, but because of their total body problem,
yes.
they will always influence their skis, although they have perhaps good legs, but their total working is that they influence their skis. So it's a really difficult classification, and we were discussing as well, when you find a little bit of spasticity, you might be going to a LW3, but when you don't find spasticity and you see he's doing how he's performing the coordination test, it's the only thing you can rely on. But then you must say, is it that his coordination is not okay due to his body or due to his control in his legs? So it's really really difficult athlete.
I think he couldn't ride a ski. It's very difficult.
Yeah.
So I wonder that cerebral palsy with accessory CP can.
Some can ski very well. Yeah.
Sometimes very well.
Yeah.
Oh.
And in this case, I think some groups decided to be him 5'7"
Yes.
Yeah,
5'7"
and other group on LW3. It depends on what you find in it, but the most important thing will be observation.
Observation.
And then you observe what's happening in the legs. And sometimes, we had in Canada last week a boy, he was about the same. And when we saw him skiing, he just had perfect carving skis. So it was, okay, this was working all the time, but his legs were doing like this. So he was an arm, double arm. But then is observation important. But when it's a beginner, then you must say, we see you in 2-3 years and how it works out.
Okay, and another question, 5'7" and 6'8" with amputee can wear prosthesis, upper extremity prosthesis. Is it okay?
Yeah, but no one with an above arm will use a prosthetic because it's not helping in the balance. The lower ones, they use most of them, the prosthetics, but the upper ones, they never do.
For balance, they can wear prosthesis. But in the checklist, a small book, World Paralympic, in the book, it allowed, but I'm not sure that what kinds of prosthesis could be allowed.
You could allow, but it's mostly a passive prosthetic. They're not allowed to have mechanical things in it, and that doesn't help. Because it's only that they make a longer arm that you can balance more
but
like
for balance,
yeah.
It's okay.
Yeah. It's for balance okay.
Oh,
yeah.
it's okay. Oh.
Yeah. It's only when you have.
How's the pole? Pole is fixed
No,
to the
no. No, you're not allowed to hold the pole, but that's in the rules. When you are a 6'8" or a 5'7", you're not skiing with poles.
But
Even not with a prosthetic.
if
no.
the fixed the process is not allowed, just process is allowed.
Yeah, so
Okay,
it's
thank
only
you.
allowed for the balancing part. And some people, when they have only a below elbow prosthetic, they use it to guard the gates.
Well, yeah, and it shouldn't be longer than the other.
Yeah, it must be the same length. When they have a prosthetic, they must have the same length in your prosthetic as your other arm. And the exact rules about the prosthetics is in the equipment rule book, and you can find it on the website. And I think perhaps important to tell a little bit more about leg prosthetics, because there are more and more sophisticated prosthetics coming. nowadays they're allowed to have this foot that goes directly in the binding. That's more direct fixation. But there's not allowed that there is any motor thing in it or computerized thing. So there must just be mechanical, pneumatical, something like that.
Just going back to the cerebral palsy, most definitely it's observation on snow that would help us determine where the impairment is and then help with the class allocation. Because in a room where it's nice and warm, it can be very different to on a mountain where it's cold and that they're having to travel very fast. So for the two athletes we had yesterday, they were very difficult ones to assess, and watching them ski or snowboard would really help us determine where the impairment is, bearing in mind that they're both beginners. So that makes it difficult as well. But we often come up with challenges like this, so it was good to see it to understand how difficult it can be.
Yeah, yeah. And like in CP Hemi, sometimes you have a very bad arm like this, it's there all the time, but then the leg is not that much affected. So they will be 9-2, and you ski him down, you see the arm always there. You said, why he is a 9-2? But look at the skis, able to control both skis. That's the most important part in skiing. The arm is important, but the leg is more important. There's always in the decision making. And so when you're in CP, when you're not clear, you always give the least impaired class. So when we would discuss about a 9-2 or 9-1, you give the 9-2 class, you observe, because when you want to decide to give another class, it's easier to give them more impaired class. Then someone will be happy. Or when someone is be putting back in a less impaired class, he's unhappy. So that's why I always give the less handicapped class first. So that's the CP part. I also saw some people are more used to do the orthopedic assessment, and then it's difficult to do the neurological assessment. So that it's perhaps good to concentrate in your regular job how I get the arm or leg good relaxed so I can find the reflexes well. It needs to be doing. And like me, I'm normally treating small children, then I can do it like this with my finger, and then sometimes I have such a big leg. Oh yes, it works, but you must do and train in it. We didn't do very much muscle testing. We only did the muscle testing on the one with spinal cord. And there, I think we noticed that it's good that you have in mind what do you want to test, that you don't have the athlete sit up, lie down, left side, right side, tummy, back, left side, sit up. So that's happened in our athletes, and then you forget what to do. So it's always good to think by yourself, where do I start, what position, what can I see here, what do I need to know more, and then change to the other position. And then we discussed also, what do you do when someone is not giving his best and you don't trust it? Then you do what we did with the athlete, have him back, side, up, down, so that he gets confused. Did you have other? I think then there was more in the assessment thing. Oh yes, in the assessment, you talked about the safety. It's always start with the more simple things first. So you know when someone can walk, then you can start running. When someone can stand on one leg, then you can do the hopping afterwards. Because when you do this complex thing first, and that's more, it's not so good to do. So always think what's easy. And certainly when the athlete is young or anxious, it's easy to start with an easy task he can perform. It gives him trust. Oh, I can do this. So then he can show more relaxation.
So what is the observation process? Can we see is playing on the screen? Or
Can you please, I'm deaf, so please.
what is the observation process? Can we see the athlete playing on screen or
Yeah.
at the site
Now,
directly?
when we do observation on snow, then they go to race. So we talk with the race officers or one of the judges or one of the coaches. What is the best place in the course? We can stand and observe the athlete from coming down, passing, and then from the back. And sometimes it's also very good to observe at the start how they get from their wheelchair in the sit ski. So that's good when you have, say, in Holland, we have an indoor snow hole, and they do three runs. So you can be standing in the beginning and look how they perform in the sit ski, getting in and getting out, getting in the chairlift, getting at the start. So that's important to observe. Then standing somewhere nice middle so you can observe all actions. And then we will show you how you can use the form for it. But yes, we always observe the first appearance. And like last week, we were in Canada and we saw in the first run all athletes we wanted to observe, but half of them fell down. So it was no need to observe the second run, because the second run, only the ones who were standing after the first race do the second run. So it's, sometimes you must just note down, I could not observe because he fell down at the second gate. Yeah. And so when your decision is dependent from your observation, like in the CP, then you can just write down, he stays in the 9-2 class because we're not able to observe due to fall. That's then, yeah, pity for him, but next time he comes for review, and then you say the review 18-19, that's next year, then he has a new chance to show how good he is, or not.
Do you mean it during the officer training, or can we make our attempt to understand?
The observation is always in the race.
Always in range?
Yeah, the observation is always in the race. Yeah, sorry, I forgot the microphone. Yes, we observe always in the first official race.
Officer range, yes.
Yeah, and in Nordic it's different. In Nordic, they also observe training. But in Nordic, they have, say they run 5 kilometers, so they pass by 20 times the same track. But with us, they have 1 minute, so they go down. So what we now start using is we take a video. So when we're not able to see everything when we're standing there, we can check it in the video. But that takes more time. So when you have 15 observations, and you also have to check 15 videos, it's really difficult, because I don't know if one of you is using video observations, but when you have them all in one camera, you must find, is this number 20? Yes, number 20, and it takes really time. It's not done very fast. So we need it as an extra after. Sometimes you observe, okay, clear, this is exactly what we expected. We don't want to see it on the video. I think then after assessment, I also noticed that some people like to test more. Let's also say an amputation. We only test on the length. And sometimes, I test also the range of motion and the muscle power and everything. You're allowed to do it, but it's not, you don't need it for your decision making. But only, we discussed it, only when someone has a history, say like of motor accident, he has an amputation, but also plexus lesion in his pelvis or something, then it might be important for, say, when he's going to sit ski. So then it's important to test also other things. But normally you just test the impairments we want to know. It saves your time, but it's also, it's not necessary to test. But when you test an impairment, you must test it completely, not just around the hip, but then you have to test until the feet, everything. So somewhere you have to think, okay, now we have to start with decision making. When you want to really discuss with your colleague, then you ask the athlete to go out. But sometimes you all both know and you just point 11. And then we don't have to really discuss, and we can already explain to the athlete it's going to be which class and why, or. And it's always important to ask, do you understand? Do you have questions about it?
As well, if you finish your assessment and you have and the athlete leaves the room and you discuss with your colleague the assessment, it might be that in fact you want to see something else. You want to see the athlete again and maybe test them again, and that's okay. So the athlete comes back into the room and you might repeat some tests, or you might do some different tests. And then sometimes we have the athlete leave the room 2-3 times, but it's to really make sure that you do a thorough assessment so that you come up with the best outcome for the athlete. So again, that's okay if you want to repeat some tests or do some new tests. We had some questions yesterday about the signing of the form. I'm not sure if you spoke about that when I was out of the room. There was a question about if the athlete doesn't agree with the class, whether they still sign the form. And yes, the athlete does still sign the form, because what that means is that the athlete has just acknowledged that they've been told what their class is. If they don't agree with that and they want to protest, that's okay. They just then have to fill out the protest paperwork. But we were discussing last night that at this level, not to get too caught up in the protest and appeals process. It's very complex. So for you now, just to understand that it exists, but not to get caught up in the processes too much. Okay? So the athlete must always sign the form along with the coach, or if they have a person with them. Okay?
And in our decision making, we had discussions also about when do you confirm and when do you give review. And what is the difference between we have confirm, review, and review with fixed dates? Most of the time, okay, when someone has an amputation, it will not change, you can confirm. When someone has a neurological impairment, we want to see them a second time. That's what we discussed each other. Only when it's, say, a complete plexus brachialis, 20 years old and no muscle at all, then you can say complete. But so the other ones we want to see once again. But then you must think why I want to see him. Say, a young one with cerebral palsy, he is going to grow. He might get some different effect of his impairment. So you don't want to see him next year. You want to see him on the end of his growth. So when he is 14, you say, I want to see him when he's 18. So then you must count for 4 years. But when someone is just 12 and he is a short boy, his father is 2 meters long, then you know that in those 7 years between he's 19, there will change a lot, and perhaps very bad for him. So that might be better to ask him back with 15 and then again with 19. So it's usually also your professional judgment. Why do you want to see him and what can I expect that might be changing? In a progressive disease, someone might get worse every year or every 2 years or every 4 years. It's good to give them the review in a good amount of time, but it's not nice to come back every year. So you can tell him, okay, I don't expect you to change to another class in the next 2-3 years, so we say 3 years. But when the athlete thinks my impairment has been really going very bad in 1 year, then he can come earlier with a medical review request. So 3 years or 2 years is sometimes with some progressive diseases is more nice to have. Well, guys have to be every time coming to this classification. And we only classify at the lowest level of competition. So they have to come to an easy competition. And perhaps they're already racing at World Cup level and didn't want to go to Holland to race in a snow hole. So it's better to give them a little bit longer time.
So We also had a good question about when to put, if this impairment is progressive or when it's stable. Is it progressive if you suspect that it will be worse in 5 years, 10 years? When and where's the line? Where do you draw the line? And that also affects how, when do you put review?
Yeah.
If it's progressive in, you suspect, okay, in 10 years she may be worse, then should you put her on review, or can you confirm her and let the medical review be the next step? Or so, yeah.
When you have a progressive disease in 10 years, that's what, then, yeah, you could do 10 years, but you could also say, just be confirmed now and come back and ask for medical review when you feel yourself you need to go to another class. Yeah, but that's again, when someone, you can discuss it with someone who knows he has a progressive disease, you can discuss this with him. We have someone who has a progressive disease, and I know in several years he will be not standing but start sitting. Okay, at that moment, he will come by himself, and before we will have to see him as well, but when such a big change will happen, they will come by themselves earlier. So we discussed with him, 3 years is enough now, because it's not nice to be coming every year for the review. That's what also, you have review fixed dates, so most of the athletes, when we give review, we say exactly which year they must come for classification. And that's important because that goes in the system, and when he wants to race after that year and still has, say, when someone would have review 16, 17, that was last year, he would not be allowed to race anymore. So he must report in that season for classification. He must do it himself. We're not going to call him, hey, you're on the list, you must come this year. No, they must do it themselves. And so when you only say review without a date, it means that he must come the next classification. And he cannot race when he doesn't do it. So it's almost a punishment. And we use it when, say, someone just has, we have not been able to do everything, but just, okay, you can race, but we need a little bit more. We want to see that X-ray, and you come the next classification. So you said then review, and then he comes in 2 months, 5 months. But this is always, that's the discussion you will have with your senior classifier to know what's the best decision. Shall we have the non-eligible? I think. Yes, we had. It was good. We had a non-eligible athlete, and then you see that it's difficult. You were at once. I think you're non-eligible. Yes, I think she's non-eligible. But that's why I also was pressing that we will get the good measurements. But then somewhere it was with you. You think, oh, I think we tried everything. We didn't find enough impairment. Yes. And it's difficult to tell someone. In this case, she didn't want to ski, but didn't want to snowboard. But it's important that you, certainly in such a case, that you perhaps do some extra tests, that your colleague does the test as well. Let the athlete go out and then discuss, is it really non-eligible? Perhaps we do this test. So, but then you agree, is she or he is non-eligible, you have to explain. And then you directly have to offer that they can be seen by a second team. So non-eligible cannot be confirmed in one time. Even when someone happens to come with only his fingertop amputation, it's 100% non-eligible forever, but he still has to be offered a second opportunity to be seen by another team. So you have 2 panels, and then you can say non-eligible confirmed. Or when someone is, because when you only have 1 panel at classification, then they have to come to another classification opportunity. But when they are sure I will never be in the skiing, then they can sign a form, a waiver, that they don't want to come for a second time, that they agree that they're non-eligible and that they stay out. But non-eligible, telling non-eligible to someone who is really wanting to race, it's really difficult. And that happens most of the time with someone with me, with someone with cerebral palsy, and then sometimes their understanding also is a little bit more difficult, and they get emotional, and it's so difficult to tell. But yeah, it's. And sometimes the athlete says, "Oh, it's fine," and the coach is not so happy. That's also happening. Yeah.
And also, I have a question regarding on the classification issues. According to the minimal impairment criteria on LW681, it says the muscle power impairment is equivalent to that of above elbow deficiency.
Yeah. It's
So-
not very clear.
Yes, but what if we have an athlete with below elbow amputation with severely restriction of the range of motion, like fused elbow and some restriction of shoulder joint? In the cases, I think is like equivalent to the above elbow deficiency. So, what that?
Then that's really a borderline. So when he has a very good shoulder, he still can be able to knock away gates. Well, say it was a motor accident. He has a plexus lesion and an amputation, can be. So he cannot use his arm to work against gates. But that's a borderline. Officially, we say there's something below the elbow, but it's not official functioning. So you must look into function again. You have to.
As he said, it's a borderline case. Then we categorize to less impaired category first.
Yeah.
And then 1 year or 2 year re-evaluate.
Yeah, and we observe in the
That is
skiing.
a good concept.
Yeah, and you observe in the skiing how they use their arm. I'll take my coffee.
We've had a couple of discussions around athletes who come with 2 impairments. So in this example you've given, the athlete has an amputation as well as a restriction in the range of movement. But maybe it's the restriction in the range of movement that is his primary impairment that may put him into 681. So we would look at his function to see whether he can actually use that limb on snow. So if the restriction was so much that he couldn't use it as a lever, couldn't use it to deflect a gate, then I would consider that he would be a 681 athlete.
Yeah.
Would you agree, Sandra? Like looking at
Yeah,
those
yeah.
two, when you've got a combined impairment, it can be difficult. But you look at that's the main impairment here. Is it the weakness? Is it the amputation? Is it the loss of range of movement? Because our classes aren't structured when there's a combined impairment.
And it's also good you remark, because now it's not very clear, because it must equal above elbow amputation. So that's our, what do you call it? Legacy. That's what we got from the old classifiers. That's the rules we have. And we're currently behind the screens already writing new rules about it. So that we get a total score of how many muscle power you must have and how many loss of muscle power. So we're busy doing it. And that's why we do it in snowboard. We could do it directly in the right way, and that's where we have a nice muscle power scoring system for.
I have a question about progressive disease. And is there I'm just curious about the youth, the younger the athletes, if they have the competition, the younger class, the youth.
Yeah, that I
Is
must
there?
say that the age when they start international competition, that can differ per year with the rules. They change it every year, but sometimes we also have special youth competitions. So mainly 12, 13, 14 is the youngest, and nationally they can race much younger. But when we have a special use competition, then certainly 12 is the lowest. I don't know what is the exact age now, do you know?
So 13 years old comes and it's progressive, then you give review or
A review,
confirm it?
yeah. It's double
And-
review.
So review, if you review it, then this athlete can't compete.
No, review, with review you can compete.
With the review, you can
Yeah, yeah,
compete also.
it's a status, it's just you have your class
Oh.
and your status is written behind it. So
Okay.
you can compete until you must come for a review.
Okay, so,
Only when you give classification not completed, then he's not allowed to race. So that's classification not completed is really poor, because then we could also not observe.
all right. So you compete with the lower class
Yeah.
before you review it. So after the review, it might go up.
Or
but
may stay in the
may
same.
stay, but
Yeah.
yeah.
The discussion we had yesterday is that if an athlete is borderline between two classes, it's better to put the athlete into the more able class. Yeah, because it becomes easier afterwards that if there's a shift and they go into the more disabled class, then that's easier emotionally for everyone involved than if you have to shift an athlete from a more disabled class to a more able class. It's not fair on the class if you've put an athlete in there who potentially is too good to be there. That sits a little bit differently from what I think you're saying, but if an athlete is on review and they haven't presented for review when they're supposed to, then they can't race. Yeah.
So that's when they're after the date they should have been there, then they cannot race. But until that date, they can race.
Limited range of movement is involved in eligible impairment type, but in the table, there's no mention about it. So, for example,
That's again something we.
Professor John mentioned before, if he have elbow contracture, is above elbow or below elbow? For isogryptosis in our elbow is LW 6, 8, 1 or 2, elbow contracture.
Yeah, when that's again something you must see the complete. It's not just the elbow contracture. Say when the elbow contracture is like this.
Extension or flexion, it doesn't matter. Just foot.
No, it does matter, because we observe. Say when there's a good shoulder and he can use a very long elbow.
Yeah.
Then we say it's a 2. But when it's one like this and he has no shoulder, then it's a 1.
Wow.
So it's again with the function to it.
Oh.
Yeah, but that's again an observational thing. We have an athlete and he has 2 arms like this, and he cannot do anything with it. So he has a complete picture, but he can only do like this to hit a gate. So those things are there, but they're not useful. But when they have more like this, then you already, oh, you see, I can hit it. So then it's more functional. So
But with the medical review on medical perspective, below elbow means he can use elbow joint, and
No.
above elbow he cannot use.
No, it's not
elbow joint.
only the elbow joint, it is the complete arm. And because in the old, very, very old rules, it was almost only amputation, so that's why they said it like this. But we see it as a functional thing. Can you use your arm for the balancing
Wow.
and the gates?
Okay, very informative.
Yes, very important, yeah. Some more question perhaps from that side? No questions there? I would like to talk a little bit about the observation. So soon we will have videos of alpine and snowboard, and we try to observe. And that's good when you have your book. We have the observation forms in it. And then the very first page of the observation form sits on in the big book page. I don't know. No page. There are questions. The first question is, was the athlete able to complete a ski run to be observed? Okay, sometimes you already have to say, sorry, fell down, not observed. And then before we observe, or, is he new in the sport? Is he untrained? And that's, or has he new acquired disability? An example, we have a ski racer and he had a new amputation. So he had an amputation before, but then he got another level of amputation. So in the first month after his new amputation, he missed his balance. So he was skiing in a different way. So that's also good to know. Perhaps someone is racing a longer time, but then happens something new. So that's also good to know. Does the athlete's skills look poor? Sometimes someone skis already for 20 years, but never have been good trained. So that's why you need to have knowledge of the skiing. Or how are the ski conditions? When there's a perfect slope with nice snow, nice sun, then you see something different as from an icy slope or a muddy slope, or when there's fog. Is the athlete giving best effort? Most of the athletes, when they do a ski race, they want to win, so they give their best efforts. But perhaps in some cases it might be that you think, hey, he's racing completely different from what I've seen when he's skiing World Cup. It never happened to me, but in theory, it could be that he said, this race is not important for my points, so I do not my best. But I didn't see it. And then other things. That's what you observe. How is he walking with ski boots? How is he transferring from a chair? How is he doing in a warming up area? So those observations you can see. What's he doing with the pole? That's important. Then we go to page 2. So first we will do standing skiers, and then you don't know in this case you don't know anything of him. So you must see for yourself, is it an upper limb impairment, is it a lower limb impairment, or is it an upper and lower limb impairment? Then you can go to the next step. Is he skiing on one ski and on two skis? Do you think, has he two problems, 2 legs and a problem, or 1 leg a problem? So it can take you time to see, where on the list I am. So you can follow it, and then you can more and more to what you have to observe. Say, I see someone skiing down. He clearly has 2 poles, 2 skis. Okay, I don't think there's an arm problem, so it will be a leg problem. 2 skis, okay. Then you must see, is he able to control both skis? Or is he not able to control both skis? Or do I see 1 ski, 1 leg going like this? So that's how you follow it. And then on the end, you can also say, okay, that's the class. And the same is a little bit in the arms. You see no poles, then there will be 2 arm impairments. But sometimes someone just chooses to ski without poles. So it's not always the giving away. So I think the best thing is we just start with observation, and then we see if you can follow it. Yeah, I don't know the exactly page, because I think, I don't know the page. So everyone find the alpine skiing classification observation standing. You have it all standing. There's no page numbering. Let's see if you have them all. Yeah. Oh, Can you ask Elke if we can get our start lists? Yeah? Oh, Elke was printing it. You have one? No, you
Yeah, there's one.
Okay, this is a video from last year in Treviso World Championships, and this is the second run for the men standing. You want more sound or? You want sound? I have it. Let's put it out because I'm talking. I hope you can see. We start with an easy class. I'll stop him now. Perhaps we just try to start with the booklet. What do you see? Please shout out.
Say again?
LW2, and why? One ski. Two. Yeah. Do we all agree? LW2? Yeah. So this can be, sometimes it can be easy. He has 2 complete arms. And why do you say 2 complete arms? Yeah, yeah. It could be, we have one skier in the circuit, skis with 1 outrigger, 1 ski. And she is a 9-1. So look perhaps for yourself how he controls his ski, how he kicks away the gates with his total body. It can be very hurtful. They have very blue shoulders. And officially they're not allowed to touch the snow, but it's difficult when the hill is steep, then they can touch with the other leg. So. Okay, this one. What do we see now already? Oh, well, let's say, must go back because I don't have the names. Wait, let's find the names. Yes, I have the name. This is, yeah, I have him. Can you see already something? How many skis, how many poles? Two skis, yes. 2 poles, yeah. So let's try if you can find, has he 1 arm, 2 arm, 1 leg, 2 legs problems? It's not that easy, is it? Yeah, perhaps it's difficult to see here, but no problem. I'll try to find a moment where you can, perhaps you can see it more here.
There are some good answers.
Yes, okay. 3 or 4, okay. And when we would see 3 or, perhaps what would be the difference between a 3 and a 4? Two? Yeah. So the difference between 3 and 4 is he problems having a 2 legs or 1 leg? So now we must decide, has he 1 problem or 2 problems?
Maybe LW3, because it's symmetrical. No?
No, it's not. Try to. This is a good turn. This is a good turn. Try to see this one. It's really difficult. It's really difficult. But wait, a little bit back. Left. Yes, left. He was just do a little bit back. Okay, I want to go back. Here, you see his left leg. Now he gets less control of his left leg. It's really difficult to see. Yes, he was a little bit shaking. Yes, it's really difficult to see. But his left leg, when you look very well, he's a little bit standing more on his right leg. His left leg has a little bit less control. Certainly on the end of the course, he gets more problem. He has an amputation skiing with a prosthetic on the left side. So he's very able, so I was trying to find a picture where you can see that there is also a little bit difference in how far he bends his knee. But he's doing so well, and I don't have the right program here to stop it for everything, but he's LW4, yes. Yeah. Below knee.
Above knee could be involved in LW3.
No, LW3 is only we have two problems.
One above knee amputee.
If an athlete with an above knee amputee skied with his prosthesis, he would be LW4. Yeah. He would be very disadvantaged LW4, but that would be their choice to wear their prosthetic. Yeah.
Okay. At the start, you already can see now how many skis, how many poles. 2 poles, 2 skis. Okay, so this is I think a good picture. The ones who have more skiing experience, try to see the difference between using the knees and the hip flexion. He's out of sight with his name on it. Anyone an idea where to look? Which side or both or? Oh, that's a pity. I'll do him back a little bit because it's. When you look good, you see he's not that able to control around his knees. He uses a little bit more in his hip flexion. You see, still he has quite good control of his skis, but he does it a little bit higher up than when someone who has very good control of his lower part. Oh, there he goes. Someone idea, what could it be? Yeah. So with both, it would be? LW3, yes. He is LW3. He is asymmetrical in his spasticity because he has a CP. He is asymmetric in his spasticity. So when you see a longer race, you see that one side gets worse and worse. But he has both sides. And that's when in the beginning you saw he's more stiff around here. But it's still, they're good. This is World Championships level, so it's not easy to see. Okay, I don't know if the next one already started, because we have, okay, here you can see at the start what you see. Okay, yes. Arms, legs, poles. One pole. Yeah. look at the leg. Is there a problem or not? Oh, this a little bit for. Yeah, see it here like this.
The angle of trunk and thigh is a little bit shallow. So right, left, a little bit.
Yeah,
And he became become
Here.
wider.
yeah, it's wider. Here you see he's relying on his left leg. He's etching left leg. His right leg, he has not much control. He's almost going in a snowplow. I must tell, he had a knee operation. Before, his knee was like this. Now he has more control over it, but can we already think which direction you can, what kind of diagnosis, what kind of class? We decide he has an arm problem. Exactly. It's a 9 class, and he doesn't have the good control on his right leg, so we can say 9-1. Yeah.
This is a good angle because you can see that
Yeah.
he doesn't have that control over the right knee when he's going around the gate. It even looks a bit atrophied as well from here.
Yeah.
Yeah.
It's true. So this is a real good example of a 9-1. I was looking up this race and then, okay, they have all the classes in one line. Okay, this is one. Perhaps I'll go a little bit backwards. This is a really difficult one, the next one. Not this one, but the next one is really difficult. Oh, he already started. Okay, how many poles, how many skis? No poles, 2 skis. And watch, I think this is very important to see. He has no poles. See how he used the wide stance to control, and that he needs to step off to get more control. Perhaps look well at the legs, like this. And then you see the shaking of the legs.
Yeah, look at that left leg now. Ooh,
Here,
oh.
here. Right one is also not easy, but okay.
Actually, Sandra, do you want to take that one up to the beginning again?
Today,
Or-
yeah?
Yeah. I think this is a really interesting athlete because on first appearance you think, oh, it's got 2 arms, but then you look at his legs and you go, hold on. And yeah, if you just look at the legs and he's got very poor control.
I heard some 9-1. Something else?
What about
LW3. What about 5-7 something? This is really complex case, and the right answer is already given. He is skiing currently in 9-1. Then you would say he has 1 bad side, but he has 4 bad sides. Yes, he has arthrogryposis. So he has some he has a very big range of movement problems, but his arthrogryposis is due to a neurological disease. So he also misses lots of muscle control. So in the examination in the assessment room, they found that on the left side there's really less muscle power than on the right side. So in the end, they were looking in all the classes. And you can say 2 legs, that would be LW3, but he is also impaired because he has no arm control. When you only would give him the arm class, 557, whatever, that would be very competitive. Then he has very bad legs, so it's not fair to give him the arm class. So you look for the LW3, the leg class, but then the 9-1 class gets a better factor, and then you have leg and arm problem together. But there's no class for having 2 arms and 2 legs problems. He has 2 good legs for being in an LW1. So on the end, 9-1 was the class. But this is someone you really need to see the paperwork on.
So he can choose even
He could choose, but then of course he took the one with the best factor for him. Now, the next one, I think everyone is able to do very fast. Look here, you look how much problems but he has quite long arms. Okay, this one everyone knows at once. What is this? LW2, yes. Yeah. Now you see also how much more able he is to control, to swing his body on the slope. Like the one before, France, he has to push off all the time, and he can really fluent ski. Okay, how many poles? 1. How many legs? 2 skis, yes? So now we have to decide, do we see something at the leg or only an arm? It helps you very much to see those films more and more, so it's good to train yourself on it. You see here he has an arm, you see he has a complete arm, but it's below his bib. What'd you say? 681, yes. And 681, he has a plexus lesion, so he has his arm is like this, so he puts it away, otherwise it's dangling there. Yeah, and so when you see this one and you compare it with the other one, okay, you see this is good legs, and the other one he hasn't. We get all different classes. This one. But you see, how many poles, skis? 1 pole. Short, long arm. Yeah, you see how he uses his long arm to guard the gates. It's real different from the one with the arms like this who cannot do it. So this is clear, 6, 2, yes. Yeah.
And so this brings it back to the example when someone has a loss of range of movement, where we would look on the snow to see how they can actually use their arm. And that athlete that had the 2 arms, I don't know if you noticed at the end, but he went to raise his arms to celebrate his finish, and he could only get to here. So if that particular athlete didn't have a leg problem, I would almost consider that they would be a 571.
Yeah,
because even though he had a long lever, he couldn't use it because of the loss of range of movement. So.
And in between you can see the next one. You see again how he uses his arm to guard the gates. It's really useful. And the class is 682, because this is different from the one before. It's from your country. So this one. Okay, oh, it's not good to see for me. How many poles? No poles. How is he using his arms? Has he good elbows, shoulders, etc.? How is the legs? Yeah, good control of the legs. Oh. Yes, 573. And you see a little bit, when you would compare him, that is the last picture, when you would compare him with someone else, has a wider stance in skiing. He needs more balance from below. He has no hands. This is, yeah, this is I think a good example. You see one pole, one arm. What's he doing with the arm? Is he doing anything with it? He's guarding the gates with his good arm. (681), yes. And now you can be deceived because you see a complete arm. But this is exactly he has also a plexus lesion, and he has also lots of contracture. So this is the thing he has. It's no use for him. But he doesn't like to have it below his bib, but he likes to have it there. It helps him still a little bit in balance. But sometimes it can be dangerous when you go around a gate. It might be dangerous. So some people don't do it because they get a luxated shoulder. Oh, yes, okay. It's so many different things. We get more. Next one. What do you think? Okay, you must see which leg is, because you should look in the leg, which leg is less controlled. It's very difficult. He had a left amputation. So he was a LW4. Yeah. This is an easy one again. Yes, yeah. But we did a course and someone wasn't able to do after the course to say, is this an LW2? Yes. So this is okay. Then we get an interesting one. So it's also good to watch, observe lots of films that you get it in your back head to see what's happening. He skis nice and fluent. Oh. Okay, what you see? You see outriggers. How many skis? 2. Okay. 2 outriggers, 2 skis. Look at the skis, what's happening with them? Yes, they're very close, they're tied together. Look where he skis mainly with his hips. And he skis en bloc with his legs. And
if you look at the knees, they're not, there's no flexion or extension happening.
What kind of...
Someone said the answer.
Okay.
After 2 seconds, the answers came on this side.
Okay, LW1, yes. There's something I heard yesterday, because in LW1, you are allowed to attach your skis, but it's not obliged. It's not you must not do. You are also allowed to keep them free. So there's also one skier in the circuit, and he has a balance problem, and he skis this wide. When he would tie his skis together, he would not be able to stand on it. So he is allowed, you are allowed to do with your skis what you like, but you're allowed to tie them together. So this is Adam Hall, and he's a very good skier, and he will be third in this race, or second even.
And it's good to remember this athlete, or maybe when, oh, actually, no,
Yeah.
I'll come back.
Oh, wait, okay, yeah, this one, okay. This one, observe well, how many skis, how many poles? I think here again, you must look at how he uses his knees and his hips and see the difference it's getting in the length of the race. It's not easy to see this one, but do you think 2 legs or 1 leg? 2 legs, yes. I think this last part was almost 2 legs. So we get. He has very high spasticity in his legs. Yeah, yeah. He does much more above than below, but it's really difficult. And there's lots of people discussing him because he's very good. He will win this race. He will be a world championship, and he's world champion. He's 16 years old. So everyone is coming to us, how can that be? He just enters the circuit and he's winning. Yes, he's good. But he really, when you really see, he is stiff in that part, and he has lots of compensation above. I can tell you, he has been a ski racer since he was 3 years, 4 years old, and has been training national level. And then somewhere they discovered that he was getting more stiff, and then they discovered a progressive disease. So he has he's been learning to ski from very young. So he has already done all those trainings before he got really affected. So that's why he can use it still. But I know that he will get more and more difficulties to do it. But you must really observe the complete race and not just the start, but you see the complete race, and then on the end he's not able to do. So LW3. Yeah, it's a diagnosis. Yeah. No, yes. Yeah. Yeah.
And if this onset age is about 15 years.
It was 12 in his case, yeah. 12, 13, yeah. So we know what will happen. And the general public doesn't know. They only see what's he doing now. But we will know that perhaps in several years he will go to LW1, and perhaps he goes to sitting. But I was observing him afterwards. He went to his parents to say, "How I won," and he was walking without his ski boots, very on his toes. He has very high tone. Certainly after a downhill, 2 minutes, he couldn't walk out of the ending area.
So he's on review?
Yes.
Fixed date?
Yeah,
Yeah.
he's on review. Oh, I did something wrong.
So those two last athletes that we saw, the LW1 and the LW3, I'm wondering if we have time just to look at them quickly again, Sandra.
This is Adam.
So this is the LW1. So look how much he relies on his upper limbs to compensate for the weakness that he has in his legs. And you'll see that he skis little use of the knee or his hip. He's using weight transfer really to help try and get the edge.
Yeah, he's more using his upper body. When you would see him, that was the first picture. When you saw him coming over the top, it could be a sit skier.
Yeah. So really using the upper limbs a lot here. So LW1 is the class for very weak legs. Yeah. Two legs.
Or very stiff legs,
Yeah.
or high amputations.
It's almost
You see,
like
he's skiing as one part below.
And so so the next class is LW3. So see here, there's not so much reliance on the upper limbs. This athlete can use his legs to edge his skis, and this is the big difference between LW1 and LW3. The athlete before had the outriggers, and he always had the outriggers on the snow. But here, the athlete, not relying on the upper limbs, he could use his arms to deflect the gates, which is great. But he still has severe impairment in both legs, but just not as bad.
Yeah.
So that's a nice comparison.
Yeah. So these were the 15 top skiers in Alpine last year, in slalom. So I can go on, and then we have just 682s, 92s, and etc. But this was, I just was watching it. Okay, I have all classes in 15 athletes. So I think for this part, for the standing, this is what we show now. But perhaps you have questions about it. It's not easy, but sometimes it gets more and more easy when you do it more and more and more.
I think everyone's done very well, actually.
I think-
Well done.
And what you can do yourself, when you go to the website of, I can try to show you. When you go to the website of I hope I can write Korean, but good enough. You go to the website of the World Para Alpine Skiing. Wait. Then you can find all races. So this is the website, and you can go there to the calendar. You can see all races and all results. So here is calendar. In the upper corner here you have the calendar. You go there, and you can see here again. Dimitri showed you where the classifications were and how they were scheduled. But when I go to I looked up in the Google in the YouTube. I looked up World Championships Para-Alpine Skiing Slalom. Then you get lots of videos. And when you want to know about the athletes, you go to the results of 2016. I'll go there to January. Oh, it's should be here. Oh, that's stupid. It's exactly here. Oh, now, here you see, here those are the outcomes of the races. So I had slalom men, this one. It has difficulty to work. Okay, I don't know where it's going now. It's gone. But you have this start list of this finish list. And there you can find all the names and the start numbers and also the classes. So it can help you to look and to train what's happening. So that's a way to train yourself. Observe videos. And there were good videos of World Championships and Paralympics. And you can go for a short video, 5 minutes, but then you don't have the time to see the complete race. Okay, I think that's for now. And then we go for coffee, and afterwards we do...
We're going to do sitting.
Oh, we can do sitting after coffee?
Well, yeah. So the scheduled break was for 10:45, but if we have a break now and come back and do the sitting and snowboarding, I think that sounds like a good idea.
Yeah.
Yes?
Okay,
Yeah,
break,
okay.
and then we do sitting.
So back at 10:45.